The Obama administration is facing yet another shortfall in the Affordable Care Act. Officials say so far, more than half of the people signing up are over the age of 45. Only a quarter of them are young people, ages 18 to 34, and that's one of the prime targets of the bill.
I'm working right now. I have to wait to get coverage through the job I'm at right now, so hopefully that'll kick in soon, though.
Vanessa from West Caldwell is one of those in the 18 through 34 age range not planning to register for the exchange anytime soon. Under the legislation, people aged 26 and under are covered under their parents. But after that, one must have health insurance or face a fine.
A lot of these kids don't have jobs. They're college educated. They can't get jobs. They don't have the income to pay for this. So it'd probably be cheaper for them to pay a fine once a year and get charity care if need be.
Maria Scanella's 29-year-old son is finding himself in that situation. He's a teacher looking for work and recently went to the hospital after getting sick.
He went to the emergency room a couple weeks ago. He was ill, and now he has to pay. He has to pay the full amount.
And the Affordable Care Act hasn't encouraged him to get it?
He doesn't have the income. He's only working substitute, so he doesn't have that kind of income.
Under the law, insurers can no longer deny coverage or charge higher premiums due to a person's medical history. As a result, the White House and health policy experts have repeatedly said insurers need to sign up larger amounts of young people to balance the financial risks of covering older Americans who need more care.
The problem is we don't know who really is signing up and who is participating in the exchanges. The administration has got to come forward with this kind of information.
And then you've got the issue of if you like the doctor you have, you can keep it. You got the issue of, if you like your health care plan, you can keep it. If these statements by the president turn out not to be true, why would anyone think his economic policies are going to turn out any differently?
Now, the Obama administration is actually optimistic despite this recent criticism. U.S. Secretary of Health and Human Services Kathleen Sebelius believes that interest among the youth population is picking up, and they're also about to launch a campaign that will encourage young people to sign up by the March 31st deadline.
It's a start, but the way they went about it, I think, is a fiasco, and it's turned out to be a albatross around the president's neck.
Edward Pillardi is the retired police chief in West Orange. He says he first got health insurance at the age of 23 and still gets it as a retiree. He believes young Americans today are insecure about signing up, in part because of the healthcare.gov glitches in October.
It's a universal in several other countries, and I don't think in America today, the most affluent country in the world and the most democratic country in the world, that nobody should be without insurance.
As of December 28th, more than 2 million Americans signed up. The Obama administration is now aiming to get 5 million more enrolled in the next 2.5 months to meet the March 31st deadline. Reporting for WNBC News, I'm Lisa Wojtycki.